so that we can uh, possibly take some questions and also get ready for our 8 o'clock call. But we do want to welcome all of our guests, all of our business partners to our virtual Doctor's Edition. Every Tuesday, we do a webinar, and it's really focused for those healthcare professionals, be it a dentist, a chiropractor, a massage therapist, a nurse practitioner, a pharmacist, a clinical psychologist, a family practitioner, whatever field of medicine or healthcare. We want to get the word out about CBD and really the science behind how it works. So we want to welcome all of you. We want you to also, keep in mind of some people that you want to invite next Tuesday evening at 7 o'clock. This absolutely is the forum for those healthcare professionals. So a little bit about myself. I'm Dr. Rita McGuire. I'm an obstetrician gynecologist of over 30 years. I attended Wayne State School of Medicine in Detroit, Michigan. I came back home to Chicago and completed my residency at Cook County Hospital, which is now called Stroger Hospital. I'm also CEO of RJM Wellness and Ripped Rita Fitness. I'm a global speaker. I speak on women's health and fitness. I'm also a certifying physician for the medical marijuana program, as well as the opioid exchange program here in the state of Illinois. I'm a member of the Doctors for Cannabis Regulation, and I'm also the Chief Medical Officer and co-founder for Wakana for Life. So as healthcare professionals, we know that many of our patients are on medications, and many of our patients are on multiple medications. Why? Because we find that we will start a patient on a medication for lowering their cholesterol, and then 3 months goes by and they're back complaining of muscle or myalgias, or maybe we're showing that their liver functions are elevated. We're seeing some signs of side effects to a medication that we're using for one thing but causing another. So this is not uncommon. They say the average 50-year-old is on 7 to 8 medications. The average 70-year-old is on 10 to 12 medications. So this is really an opportunity for you to change the narrative of those that you are caring for in your practice, to have options for their health that are organic and natural options that many of our patients are looking for. So the slide here shows what many of our patients face, when they go to physicians and they ask about holistic options, be it herbs, essential oils, and even what we're going to talk about, CBD. It's a thumbs down. Why? It's a thumbs down because honestly, many of our colleagues don't get the training. They don't get the education in medical school or pharmacy school or chiropractic school, or when they're in nursing school, about the medicinal benefits of cannabis. It just isn't taught. I wasn't taught anything about cannabis or natural healing or herbs at Wayne State School of Medicine. I think many of you on the line, if you're healthcare professionals, will agree with me as well. So let's have a little discussion about cannabis, and let's talk about the different species that the cannabis plant produces. Well, the cannabis plant produces 2 main species, and one is marijuana, and many of us have heard of marijuana. It's a part of the plant or the species that gets you high. It gives you the euphoria, it gives you the paranoia, it gives you the mind out of body experience. And it does that by having a high level of what we call THC, or delta-9 tetrahydrocannabinol. That is the part of the plant or the compound that the marijuana produces in high levels. So there's high percentages of THC in marijuana, and that's what gives you that high. And then let's look at the hemp species. That's the other species at the cannabis plant. Well, what's interesting about the hemp species is that, yes, it does contain THC or delta-9 tetrahydrocannabinol, but it contains very small percentages. In fact, by definition, hemp is defined as containing 0.3% or less of THC. But the other compound or constituent that the hemp plant produces in large amounts is called CBD or cannabidiol. So it's the part of the plant that gives us the health benefits without the high. So hemp and marijuana, yes, they both have CBD and THC and other constituents, but the hemp is differentiated from marijuana because it has very trace amounts of THC and large amounts of CBD. So that's fundamentally the main concept that we really want healthcare professionals to leave with, and that is the cannabis plant has two species. One gives you the health and one gives you the high. So we're going to concentrate on the hemp species, CBD coming from hemp. Some of the other pushbacks that physicians and dentists and healthcare providers have with using CBD is they don't understand the drug-drug interaction when their patients are using their traditional pharmaceutical medicines and CBD. So CBD can negatively interact with other drugs. You know, one way is through an antagonistic interaction or inhibition, and that's the type of interaction that CBD has the opposite effect to the medication that your patients are taking. So it can reduce the effectiveness of the medication that they're taking for a certain condition. Another way that CBD can negatively interact with other drugs is an agonistic, or it potentiates the medication that your patient may already be taking. So it may make that medication too strong or become too strong. And then, of course, the pathway in which CBD and all drugs are metabolized, many drugs are metabolized, and that's through the liver. So there's specific enzymes in the liver that break down or metabolize pharmaceutical drugs as well as CBD. So many of these same pathways can either potentiate a buildup or maybe a inhibition to those pharmaceutical medications. So it's very important to understand the drug-drug interaction, and we'll talk more about that later on. So CBD is really all the rage among patients. You know, there are patients who learn about CBD through the internet, or they may see it in the gas station or smoke shops, or there may be signs on the highway with billboards. There may be signs in video stores and even grocery stores, but there is a very, very increased awareness among patients, our patients, about CBD. So they want to know more, and they really want to know more from their physicians or healthcare professionals. One thing they want to know is, does it show up on their drug tests? Many of our patients are still undergoing random drug screens. And so that's a really important question, to know if CBD is like THC, which does show up on your drug tests. So that's why it's important that our patients are using products from reputable and legitimate companies. Why? Because legitimate and reputable companies are getting their CBD from the hemp species. They're not getting the CBD from the marijuana species, which could absolutely cause that patient to be high and to have those awful side effects, but also have a positive drug screen. So let's look at some of the CBD products that can possibly show up on your drug screen or your patient's drug screen. Well, if there's a product that contains a legal limit of THC, or what we call a full spectrum CBD product that contains the legal limit of THC from hemp, that may cause your patient to fail a drug screen at 0.3% or less, or 0.2% or less. But those products that are broad spectrum products, those products that are isolates, those products that contain less than 0.0% of THC, those products are for those patients that you may have that have random drug screens. So yes, there are some CBD products that absolutely can be taken by those who have random drug screens. So how and why did CBD and even cannabis become mainstream? And it became mainstream when Dr. SANJAY GUPTA, our colleague, made a formal announcement, an apology to the public in 2014. And what he stated was that we've been systematically been misled about the cannabis plant. We, and Dr. SANJAY GUPTA, as a physician, didn't dig deep enough in the research and the data that has been collected for decades, showing that this plant is absolutely an alternative for many people who are looking for a holistic, natural way of addressing challenges in their life. And so when Dr. SANJAY GUPTA started to do his research after he made a public announcement that weed is bad and we should not be offering it to our patients, what he found was that cannabis has been very, very instrumental in helping those patients who have seizure disorders. And that's what really made him take a second look when he met a little girl by the name of Charlotte Fiji, who has something called Dravet syndrome. And Dravet syndrome is a syndrome where children have between 300 to 500 seizures a week. And it wasn't until the parents of Charlotte Fiji introduced her to cannabis, introduced her to CBD, this little girl went from having 300 seizures a week to 3 seizures a week. And we'll talk about the science behind why that happens. So it's important to know, as healthcare professionals, that the FDA has approved one prescription medication called Epidiolex for those children who have either Dravet syndrome or Lennox-Gastaut syndrome or tuberous sclerosis complex. This is the only FDA-approved CBD, synthetic CBD drug that is FDA approved. When we talk about CBD as it relates to the CBD that comes from the hemp species, it is not an FDA-approved medication because it's an herb, but it is legal. It is a legal constituent from the hemp species that is legal to consume, to cultivate, and even to sell in all 50 states. So that's important to know, that what we're talking about and what your patients are asking about is legal. Some patients may confuse what we call the medical marijuana card with CBD. A medical marijuana card is the ability for a patient to go into a medical marijuana dispensary and get products. But again, these products are sourced from the marijuana species. So these products will give patients a euphoria, will give patients a high. So that's why when I consult patients and they're inquiring about getting a medical card, I empower them and give them the information about hemp, that they can get the same relief that they're looking for from CBD that is sourced from the hemp plant. So again, hemp is defined as containing less than 0.3% of THC and large amounts of CBD. So it is the part of the plant that gives our patients the health without the high. So let's look at the many, many medicinal benefits that CBD offers our patients. See, CBD is an antibacterial, it inhibits cancer cell growth, it's neuroprotective, it promotes bone growth, it reduces seizures and convulsions, it helps with anxiety, it helps to relieve pain, it's an anti-inflammatory, it's an antioxidative, it's vasorelaxant, it's an anti-diabetic, so it helps to control blood sugar levels. I mean, it has a very, very long list of medicinal benefits. And we know that the data and the research is there. In fact, there's over 20,000 peer-reviewed articles that you can find as it relates to CBD and other challenges that our patients are facing. There are other compounds that are important to know about that the hemp plant as well as the marijuana species produces. In fact, there's over 130 plus compounds that the cannabis plant makes. So it's not just CBD and delta-9 THC, but there's components called CBG and CBC and CBN and delta-8 THC and THCV, and they all synergize on a cellular level to help our patients with anxiety or pain or inflammation, or helping to reduce bacterial and fungal infections, helping to aid in sleep. So those are the other compounds that the cannabis plant produces along with the CBD. But the most important part for healthcare professionals is the science. When I was introduced to CBD 4 years ago, that was my very first question. You know, it sounds like a snake oil. It sounds like a magical potion. It sounds like something I need to research, right? And so the science behind how CBD works is through the human endocannabinoid system. And the human endocannabinoid system was discovered when I was at Wayne State School of Medicine. In the early 1990s, it was found that every single person that possesses a spinal cord has this human endocannabinoid system. In fact, this system has receptors that is found through our entire body, through every gland and organ. And you can see here right in the middle, these receptors actually are found in all organs and glands in our body. And these receptors are looking for cannabis. These receptors are looking for these compounds that we spoke about in the last slide. They're looking when we consume CBD or delta-9 THC or delta-8 THC or CBG to bind with these receptors and send signals to different parts of the body to put our body back in balance, to put our body in homeostasis. And that's what our patients are looking for. They're looking for something that's going to give them relief, not get them high, but feeling very confident that it is a physiological and biological system that's working to do that. We also have to understand that our body produces cannabinoids like CBG and CBD and CBN, and they're called endocannabinoids. Our body produces naturally anandamide and 2-AG. These are two cannabinoids that endogenously help to keep our body in balance. But many times, due to stress or sleep deprivation or a lot of the chronic conditions that we see today, these endogenous cannabinoids are deficient. And this is why every patient needs to use CBD to keep our body into balance and to correct those deficiencies from those endogenous cannabinoids. So there's different ways of consuming CBD. There's different routes. There's capsules, there's edibles, there are tinctures that you place underneath the tongue. There's liquids, there's vape cartridges, there's topicals, there's spices, there's skin products, there's hair products. So there's different ways to really implement CBD in your life to improve the quality of your life in an organic, holistic, natural way. So again, we want to talk about the science. You know, what is the neurotransmission of how CBD and these other cannabinoids work in our body? Well, natural transmission is usually through a presynaptic membrane, then to the postsynaptic membrane. Well, the endocannabinoid system is very, very unique. The endocannabinoid system works in a retrograde or an upstream sort of neurotransmission. And I don't know if you're on the line and you're maybe a business partner and you've always wondered, well, why, Dr. Rita, is that significant? Why is it significant that the endocannabinoid system works backwards? It works upstream. It works in a retrograde transmission. Well, the significance is that when you're dealing with conditions like seizure disorder, so you're dealing with conditions that are hyperactive conditions, anxiety, multiple sclerosis, restless leg syndrome, any of those hyperactive functioning conditions. This is why CBD, when it's consumed, it's so dramatic and resolve so many of those conditions. Is because the transmission starts in the postsynaptic neuron and hits the presynaptic neuron, where all this hyperactivity is occurring, to dampen and to put the body back in balance. So the science is very fascinating when you think about in school, when we learned in that neuroscience part of medical school or pharmacy school or nursing school. This is called retrograde transmission. So again, these receptors are not only found in the brain, the central nervous system, the heart, the lungs, the bowel, the skin, the teeth. These receptors are found throughout the entire body to put our body in balance. Again, this is another diagram that shows when our patients consume CBD, when they consume cannabinoids, that they bind to receptors and send a signal to different parts of the brain or central nervous system, or they may send signals to the immune system or to the periphery to really help to address symptoms. Where do you find the science? Where do you find data? Where do you find some of the articles? Well, you can absolutely use PubMed. PubMed is a really good source for information. Again, there's lots of articles that, talk about medical marijuana and treating those veterans with PTSD. But now, since CBD is legal, now we're able to see more studies with CBD, in cancer and reducing nausea and vomiting and helping to improve appetite. Cannabinoids using, again, as a therapeutic option for those who are undergoing cancer treatment. This is an article that talks about CBD and its potential treatment for anxiety disorders as well. Using, in this study, they used a fast-acting agent. They used vapes to help to reduce anxiety quickly. Difficult to treat pain. When we're talking about our patients that have neuropathy or sciatica, are really difficult fibromyalgia patients. These studies are there that show that CBD can be absolutely an option for those patients. So hopefully you understand now the difference between marijuana and hemp. You understand how the science of the endocannabinoid system works. You understand the retrograde transmission and how important that is in upstream transmission and hyperactive conditions like seizures and anxiety and multiple sclerosis and other conditions. And hopefully you feel more comfortable now suggesting, recommending, and finding out more information about CBD for your patients. So I want to thank you. This is my email. If you have any further questions, inquiries, you can email me at ritamd@wakana.com. I'm going to bring up the next presenter, Dr. Joy Smith, who is a PharmD at Stroger Hospital, one of the lead PharmDs at Stroger Hospital. She is going to talk more about the drug-drug interactions and other natural alternatives for our patients. Dr. Joy Smith, are you out there?
I sure am. Can you all see me and hear me?
Yes, I can.
Beautiful. Okay, well, as Dr. Rita stated, I am Dr. Joy Smith. I graduated from Florida A&M University with my doctorate in pharmacy and been a pharmacist. It'll be going on 9 years this year, actually. Been an outpatient at Stroger Hospital, as she mentioned, went to inpatient for a little while, worked in the ambulatory clinics and the anticoagulation clinic to be specific. And I started in retail at CVS. So as I was going through my pharmacy career, I said, you know what, I feel like I should be doing more. Like I understand the power of medication. I understand that it can be life-saving, but I want to kind of get on the other side of that and figure out how to impact change from the holistic perspective, talk to patients about plant-based healing. So I became an integrative nutrition health coach first, still wanted some more information and fell in love with essential oils and plant-based remedies for healing. And then when Wakana found me, I of course became a dispensary owner and began to soak up and absorb everything that Dr. Rita had to teach us, and also became a member of the International Society of Cannabis Pharmacists. So just excited to be immersed in this space, to challenge traditional healing methods with plant-based and essential oils, and really begin to talk to our healthcare professionals and my fellow healthcare professionals about how this can be implemented in practice. So we're talking about why people seek out CBD, and Dr. Rita gave so much information, so many peer-reviewed articles, so much good information about why people seek CBD. And I'll focus on pain, anxiety, and depression. So when we're looking at the data from places like PubMed, as she mentioned, you're looking at chronic pain being the #1 cause of disability and disease burden globally. You're looking at anxiety affecting 18.1% of the population every year in adults over age 18. And you're looking at 6.7% of American adults that have had at least one major depressive episode in a year. As we go to the Journal of American Medical Association, we're talking about how those depression symptoms have skyrocketed compared from before the pandemic to during the pandemic. And I think that this quote is very interesting because it really applies to my line of work. I work at the Cook County Hospital, also known as Stroger Hospital, and we deal with a lot of people who get treatment regardless of ability to pay. Those people in lower economic status, lower socioeconomic status, the prevalence of the depression symptoms in the US was more than 3-fold higher during COVID-19 as compared with before the pandemic. And as we can see in this quote as well, it's affecting those in the lower, that have lower socioeconomic resources, greater exposure to stressors, i.e. losing their job, staying home with children that are doing remote learning, not knowing when those kids are gonna go back to school, not knowing when they're gonna have income. Those people are experiencing a greater burden of depression symptoms. And it's very hard to think about in terms of how people are being excuse me, I can't talk tonight, excuse me, how people are being affected by depression. So as we're talking about how people are being affected by depression, by pain, by anxiety, we know that there are botanicals or plant-based remedies that are kind of out here helping, namely CBD, essential oils. But we want to know, are there drug-drug interactions between these CBD and prescription medications? And so to dig deeper into that, we have to, go back to our cytochrome P450 enzymes. These are the major cytochrome P450 enzymes that we've learned about in our studies. And we know that they metabolize over 90% of the drugs that our patients are taking. They're also responsible for metabolizing CBD. So a deeper look into the CBD metabolism, you have CBD being metabolized by CYP2C19 and 3A4. And then it's going to inhibit the metabolic pathways of drugs that are metabolized by 2C9, 2D6, and 3A4. So can medications interact with CBD? Yes, if they're traveling down the same metabolic pathway, they can. But it's important for us as healthcare professionals to remember, we have a lot of medications that we prescribe our patients that do interact with each other. And what do? We space them out 2 to 4 hours to ensure that those interactions are not a problem. So it's the same with CBD. CBD is new to a lot of healthcare professionals. Some people shy away from it because they don't want to learn about the intricate science. They don't want to introduce something that has been stigmatized for a long time. But the important piece is to do your due diligence as a healthcare professional and know that CBD is impacting change from helping with pain to seizures to inflammation and a host of other things that we can deal with from a symptomatic perspective that can really, really help our patients. So we should not be scared of it. We should indeed be gravitating to these new methods of healing so that we can give our patients a better quality of life. So when we're talking about medications that interact with CBD, I just listed some of the common medications that a lot of my patients are experiencing. I deal with a lot of outpatient issues, hyperlipidemia, hypertension, heart complications, those who are taking anticoagulants, asthma, diabetes, pain relief. I mean, the list goes on and on and on. And these medications do interact with CBD when taken together. But what is the take-home point? Make sure that as healthcare professionals, we are, one, doing our due diligence as far as educating ourselves on what it may look like to incorporate this into a regimen or incorporate this into our practice recommendations, and then knowing that that space is going to allow patients to experience that symptom relief and still get the benefits of their medication, possibly allowing them to decrease some of them or come off of some of them at some point at your discretion as their healthcare provider. So you may want to know who's using alternative medicine. As healthcare professionals, we always want to know the stats. We want to know the data. Who's doing this? Why should I care? And so our treatment trends are showing specifically for botanicals, and botanicals being plant-based options or plant-based remedies that have medicinal benefit. We're looking from 2014 to 2025. As we go to the later years from 2014 to 2025, we see an increased an increased use of botanicals. So we're going from 2014 and going all the way up to 2025. So that includes CBD products, that includes essential oils, other herbs and other things that are really being able to help people in terms of affecting change in their health. So those botanicals include essential oils. And essential oils, as I mentioned, I'm an aromatherapist, and I really have been fascinated by how our essential oils have some of the same actions as some of the drugs that have been created in labs over the years. Our plant-based oils like CBD have some of the same actions as some of our medications. But what specifically are essential oils? They're highly concentrated aromatic extracts that are either distilled or expressed from a variety of plant material. So that's the flowers, the grasses, the leaves, the seeds, and they can help relieve pain. They can help reduce stress. They can improve mood. There's a lot of different applications that we'll see in a couple of slides. So you may wonder, what is this animal / person on this screen? And I am going to tell you all about who this animal / person is. So this is what the doctors looked like back in the bubonic plague. So when patients were experiencing the bubonic plague, it couldn't get into any area of the community without killing all of the patients. And so obviously doctors were going to have to protect themselves. And they used oil blends to douse their robes, to put in that beak-like mask that they have on. But the reason that they were able to get that blend was because of a few spice merchants. So there were spice merchants that were going around, and because of the devastation of the bubonic plague, they weren't able to sell their spices, sell their oils. So they began to rob the graves or rob the homes of the people who were dying of the plague. So when they got caught, they said, look, if you can tell me how you were able to rob these graves and not get sick and still continue to do this while this plague is just running rampant in this community, we'll let you go. So what they said was, so we're perfume and spice merchants. We have learned a lot about how to mix oils and combine oils and different things to keep us safe, to keep us healthy. And what we did is we put this particular blend on our ears, on our temples, on our feet. We rubbed it all over our bodies. And so when we were stealing from those people, we wouldn't be affected, because the oil blend, which consisted of cinnamon, rosemary, eucalyptus, lemon, and clove, often called thieves oil now, we put that blend on us and we didn't get exposed to the bubonic plague. It didn't kill us. So the doctors took a note of that, and they then doused their robes and their masks to make sure that they didn't get exposed. So you see, essential oils have been used for years and years. And in fact, medications are the new kids on the block. We've been using holistic methods of healing for a long, long time. So they've been proven. And when we're specifically talking about essential oils, we're talking about how when they're inhaled, how they get to the limbic system of the brain. So what happens when you inhale an essential oil, it goes through the olfactory nerves and goes to the olfactory bulb and eventually reaches the limbic system. The limbic system contains a lot of different parts, but that amygdala and that hippocampus is responsible for memory, for mood, for emotion, and what have you. So when those essential oils reach that area, or a scent reaches that area, period. That's why it's important to know that some smells can trigger mood. So you may smell that favorite dish that your parent or your grandparent used to cook, or that cologne or perfume that your loved one used to wear. That is activating and working in your brain in so many other ways. And that's just what happens when you smell the essential oil. Essential oils can be applied with carrier oils or with oils that protect the skin to help with pain. They can be inhaled and really open up the lung and the nasal passages. There are just so many different uses that we have yet to understand and that have been around for a very, very long time. But we just have to, again, do our due diligence to know what these different uses are. So the Asian Pacific Journal of Tropical Biomedicine puts it like this. They say once the essential oils or the oils are in the system, they remodulate themselves and work in a friendly manner at the site of malfunction. They know exactly where to go. They go into our bodies and they give us relief from numerous ailments like depression, indigestion, headache, insomnia, muscular pain, respiratory problems. When I've heard about essential oils being used in the rooms of cancer patients. So maybe a peppermint is going in the diffuser to prevent that nausea, lavender to calm the senses, to really calm down the patient. And these are just a couple of examples. It's also noted that essential oils are found to be more beneficial when you consider other aspects of life, when you consider having a good diet, knowing that when you're putting essential oils or other plant-based remedies into your body, they have a much easier time getting to the source of malfunction if they're not blocked by a lot of greasy foods, fat foods, things that are not good for maintaining your health, making sure that all of those things are considered so that we're taking care of the total person and not just bits and pieces. So these two charts, on the left-hand side, you're going to see the chemical constituents of the essential oils and the functions that they perform. And then on the right-hand side, you'll see different essential oils that fall into those categories. So for instance, if you're looking at the sesquiterpene alcohols, for instance, the ones that fall into that category, the patchouli, the ginger, the vetiver, the frankincense. If you're looking for an anti-inflammatory type of oil or anti-allergenic, you may be looking at German chamomile. And when you go back and forth, you'll see exactly how those oils are working and how they have some of the same actions as some of our medications that we're taking. So do you hear Dr. Joy saying, cut all the medications off for your patients and just use essential oils? Absolutely not. What I hope that you're hearing me saying is that essential oils, CBD, and different plant-based remedies and options can provide symptomatic relief for your patients so that they can begin to have an increased quality of life even while they're dealing with whatever ailments that they're dealing with or while they're dealing with symptoms that may be causing them distress. So a couple of essential oil safety considerations that I want to point out to you all. Don't apply to the open wounds. So if you're dealing with a patient who may have open wounds or may have any bruises of any kind, just make sure that those wounds are kind of healed and closed up, or apply them around the perimeter. Keep away from the eyes and wash hands after use. If you do get essential oils in the eyes or your patients do for whatever reason, you can use a carrier oil, i.e. almond oil, coconut oil, to really get that oil out, because we know water and oil doesn't mix. So you want to get some oil to pull the oil out. When you have patients that are just taking essential oils or using topical CBD, for instance, for the first time, patch test a small inconspicuous area, the back of the arm, the back of the leg, an area that won't be seen just in case there's a sensitivity. And if your patients are pregnant or nursing, have serious medical conditions, on medications that you're following them on, it will be good to consult an essential oil resource. I have some of those that I can share with you, or consult an aromatherapist so that we can really dig into what those interactions might be. And if there is no aromatherapist or resource around, just like with CBD, just like with medications that interact, do a 2 to 3 hour spacing between medications and essential oils, especially if there are ones that are approved to be taken internally. And again, more is not better. These essential oils are very volatile molecules. They're very, very potent, and you don't need a whole lot to affect a whole lot of change. You heard me mention diffusing in patients' rooms, whether they're dealing with anxiety or there may be some nausea or what have you. Diffusing, you want to make sure that's up to 30 minutes at a time so as not to overwhelm the senses. If the patient has an opportunity to walk out of the room and come back, you may keep the diffuser going, but just make sure that they have an opportunity to just kind of rest their senses for a moment. So I thank you all so much. That is my part, because I could talk about essential oils and CBD all evening, but I really, really appreciate your time. And I hope that you all learn something as healthcare professionals, because it's really important that we get our patients to a point where we can do both, and traditional and holistic, because I really feel like it can impact their lives in a major way.
Thank you so much, Dr. Joy Smith. That was fantastic as usual. Such a wealth of knowledge. Right now, I would like to entertain one or two questions before our 8 o'clock overview. If you're on the line and you're a guest and you want to hear a lot more information about specific CBD products, about Wakana, the company that is really leading the charge in quality products for our patients, you want to join us at 8 o'clock on that Zoom webinar. You can get that link from the person who invited you, but we'll take a couple of questions. I do want to say hello to our medical advisory board. We have Robin Tillman, who is a registered nurse, and we have Yvette Gundy Flowers, who is Dr. Joy. She's brand new to our medical advisory board. She is a yoga specialist and a cosmetologist. She is really involved in impacting the health of her patients as well. But if you have questions, you can put them right in the chat box and we will address those questions. Again, Yvette Gundy Flowers or Robin Tillman, if you want to say a word, and I think, is that Kathy Weathersby? If any of you want to make any comments or let us know if there's any questions on the chat.
For Deandra, she asked about the interaction with Ozempic. I'm going to put my email in the chat so that she can email me, and that way I can look at my resources at work to do the drug interaction check. I just
Thank you so much.
There. So Deandra, just shoot me an email with the question about Ozempic, and I'll make sure that when I go back to work, I'll run the check with those systems there.
So the other question, is this recorded? This is recorded. We will get that recording to you. Oh, and Erica Zachary is on the line as well. Erica, we're gonna promote you to a panelist. Are there any questions from our guests this evening? You did a fantastic job, Dr. Joy. There are no questions.
Well, thank you.
If our medical advisory board, if any of you want to chime in, please do at this time. Feel free to unmute yourself. I'm going to mute myself.
I learn something new every week from you, Dr. Rita. Something new.
Oh, thank you. Thank you.
Mm-hmm.
How do you unmute yourself? There's a little microphone, Yvette Gundy Flowers, and you just hit that microphone to unmute yourself.
Oh, okay. Thank you.
Oh, you're welcome. And welcome aboard. Did you want to say anything, or were you just trying to figure out how to unmute yourself there?
Well, I was just trying to figure out how to unmute myself, but I can give a testimony. I mean, I'm on here.
Perfect.
I just had to get used to the webinars. Okay, well, let me see how I do this. I'm sorry. There I am. So
there you are.
I'm still learning how to do this. I'm sorry, everybody. But anyway, I am a person that had chronic pain for years. I had third-degree burns in 2011 and suffered from all types of pain, from fibromyalgia, endometriosis, myofascial pain, just anything you could think of, migraine headaches, and it just went, the list just went on and on and on. And the doctors just wanted me to just take medication all this medication. I have plenty more. And they just wanted me to just keep taking medicine. And after a while, my friend Erica and I were talking about a new company and product that she found that worked for her MS. And Erica said, Yvette, you really need to try the product, come on board and try at least the products and all. And she gave me some samples. I joined October the 20th, 2020. And I've only been, here about 4 months now. And I tried it by October the 26th. My pain levels went down so much that I couldn't believe it. I just did 6 drops of the 500, Hempranium 500 milligrams, 500 milligrams. And I did a half a gummy for like the first 6 days. I just kept doing that. And then I used the Rita's rub and the pain cream on areas that really hurt me. Because when you have fibromyalgia and those different types of inflammations going on in your body, joint pain, that assists with me internalizing the CBD also. So you do have to layer the product if you have chronic pain problems. It really, really helps. The 500 has turmeric and black seed oil and other essential oils that really also assist with the inflammation. So I've used CBD prior to using Wakanda CBD, and it did not work for me. This product worked for me. And I'm just happier. Far as me being menopausal, I was perimenopausal, then I went through full menopause when I was miserable at night sweats, and just hormones all over the place. Now I have a balance that is great, and I feel much better.
Fantastic. We are so excited that you have found relief in a natural product. And if you're on the line and you're really, really curious about what she's talking about, we want to invite you to the 8 o'clock call so you can really learn more information about these products. And so thank you, Yvette Gundy Flowers, for that testimony, because
you're welcome.
You know, when we talk about just fibromyalgia alone, that is really debilitating and life-changing as it relates to your quality of life. So excited to have you on board on our Wakanda Medical Advisory Board, and we are excited to bring you on and have you present so many topics. Thank you, Erica. So we have about 5 minutes before we're gonna jump on our 8 o'clock call, but Erica Zachary is a licensed clinical social worker who is really involved. She is living with multiple sclerosis, just doing very well and really helping and impacting that community as well.
Thank you, Dr. Rita. I appreciate you. And I want to say congratulations to Yvette. I'm glad I see the improvement in Yvette. And you know, when you're in pain, you can't be happy, right? You can't show all of those qualities that I've known her for, because I've known her for a really long time. And so I can tell she's so much better now. So I'm so grateful that you're here. So for myself, Wakanda has been a blessing. I'm sorry, Dr. Rita, when you were talking earlier and I was starting to say something and I started chewing a pure gummy because I needed it today. And so I've been trying to manage MS naturally for the last 23 years. And I didn't start really becoming really impacted until the last 4 years. I started having more symptoms than I had had previously. Started working with my doctor, who I invited tonight. I don't know if she's on today, but I was working with a doctor of osteopathy to help me to find a product that would work for me. And like Yvette said, a lot of the CBD products that she was trying to direct me to, they worked a little, but they didn't work a whole lot. And so I ended up she helped me to get certified for a medical marijuana card. And so that was great. But like Dr. Rita said, I'm a clinical social worker. I've been practicing for almost 30 years now, doing behavioral and physical health, seeing clients who were depressed, but also had chronic conditions. And so I can't talk to somebody if all I want to do is sleep. right? And so when I was on the medical marijuana, I couldn't function. I didn't have the energy to do anything. And so I went back to my doctor and told her I needed to find something else, but all the products that she gave me, well, she told me to try, didn't give me, but told me to try in terms of brands. Like I said, they didn't really work a whole lot. So I was really grateful to find Wakana. My cousin introduced me to, and I don't even know if he knew that it was what I was dealing with. I think he got involved and he told me about it. Actually, I approached him because I was with another company shortly. And then I just decided that these products actually really work. And I love that we have so much variation in our products line. I don't know if you've seen it yet, but if you haven't, I'd encourage you to come to the next meeting because you'll see it there. And we have wonderful people like Dr. Joy and Dr. Rita. That's all about education, and it's just fabulous. So, you know, keep coming, keep listening to us, and you know, these products have made a tremendous difference in my life, and that's the reason why I felt it was important for me to share with Yvette and many other people. So, thank you so much.
Thank you, Erica. What a great share. What a great share. So we're going to end our call, our webinar, to prepare for the 8 o'clock. If you want more information about our company, our product, the opportunity, we want you to join us in 10 minutes. You can get the link from the person that invited you on this webinar to join us at 8 o'clock. So thank you, Dr. Joy. Thank you, Yvette. Thank you, Erica. Thank you, Robin. Thank you, Kathy. Thank you, business partners. Thank you, guests, for tuning in. And we'll see you at 8 o'clock. And if not 8 o'clock, we will see you next week. Have a great rest of your evening. Be well and be safe.